Last time I was on this podcast, I ruffled some feathers. I ruffled some feathers. I ruffled some feathers. No, I was even talking about the flag football. I was talking about flag football. I ruffled some feathers.
Oh wow!
The Lagos
Okay.
people.
Oh, how?
So they heard me call them out.
Yeah.
They got angry at me.
Mados.
But isn't that the best? Like you guys are supposed to be. You're supposed to be like.
It's supposed to be a bit of competition.
Yeah.
So like I think his name is Bimbo, who is like the one of the CEOs or like the founders of the league in Lagos. He was like, no, he wanted that he likes that because that's what you should do.
It's still it's
still
good or bad publicity.
But there was one particular guy that was messaging the Abuja Flag DMs and he was like going in and he didn't realize he was talking to me. He would just kept saying, bring out that girl. I was like,
That's crazy.
Shocking.
That's the whole point.
Big T, big T, big T. Big T, big T, big T. Big T, big T, big T. Big T, big T, big T.
Welcome back, everyone, to the Big Talk podcast, where we talk about the story of the African youth and everything that happens everywhere in the world. Today we have,
bro, I'm proud of you, bro.
We have-
This shit is
Why did
smooth,
you
bro.
do
I swear, that shit is
Let
smooth.
him finish.
Smooth,
Yeah, sorry, we
smooth.
did it again.
Welcome back, ladies and gentlemen, boys and girls, every race, every gender, everybody, to the Big Talk podcast, where we talk about the story of the African youth and everything that happens everywhere in the world. Today we have another special guest. She goes by Zara.
Dr. Rockefeller.
Dr.
You remember
Rockefeller.
the only one.
I don't know why DJ Rockefeller still is in my head.
Yeah.
Because
It's Doctor.
It's
Dr.
Dr.
J.
Dr. J, yeah.
So Zara, this is not the first time you're on the podcast.
No, it's
This
not.
is a sequel. You're back again, and
I
this
am.
time, we want to talk about your occupation, which is a dentist or dentistry. I swear I didn't know if that was a word.
Yeah, it is. It is actually a word.
Guys, it's dentist, right?
Oh my
It's
god.
not dentist.
Oh my god.
It's not dentist.
It's okay. Dentist. It's all the
It's
same.
some
Yeah.
African
But
Dentist,
yeah,
like
dentistry.
you're denting
Benue man
type shit.
dentist.
So yeah, the last time when we were talking about flag football, which is your thing, we briefly spoke about you being a dentist. And when I was watching that episode, I was like, wait, there's a lot of stuff that
To
happens,
unravel.
in the world of dentistry. So please, can you enlighten us? I have my first, I feel like is the most important question is the tooth fairy real?
I won't say.
Please don't mess up
Yeah, like-
a lot of people's childhood.
That's what I just said.
I beg.
I swear that I feel like that was like the dumbest stuff I believed in as a child.
Oh, tooth fairy.
Really?
Tooth fairy.
There's
I-
plenty other things. Didn't
I
you
swear
think
down.
that wrestling was real? WWE.
No, wrestling is real.
WWE.
But it's
Wrestling is real. Wrestling.
real.
Wrestling itself.
But WWE is-
WWE. But that's not
Isn't
right.
that wrestling?
But yeah, back to tooth fairy.
That's what Logan Paul is. Yeah.
So, dentistry. I mean, it's not everyone's favorite thing in the world. Everybody, the minute you tell them, "Oh, I'm a dentist," yes, I remember seeing one dentist, and it's just
Horrible experiences.
horrible experiences every day. I've only had maybe in the thousands I've seen, I've probably only seen 2 or 3. Honestly, 2 or 3 people that have probably said, "Oh, I like my dentist."
I feel
It was
you.
a good experience,
Okay.
and that is sometimes painful to hear.
Right.
But
Wait, why?
Because they hate
Painful
time.
to hear that they like their dentist.
no, that
Okay.
people don't like the
Okay,
dentist, or they didn't have a good experience, because that means they're never going back, or they just
Yeah.
believe that your dentist should be only for a problem.
Mm-hmm.
Meanwhile, the more times you go, less problems you're gonna have. Yeah.
Yeah, bro. Do you go to your dentist?
Trust me. I just remember now, the last time I went to dentist to take my teeth out because I had it was dead.
How long ago?
In 2021, it's been a year now, so everything is healed. But that guy was an asshole. I'm sorry, he was an asshole. He was just an asshole. Because I've gone for checkup before, and these guys were putting me through. But this was in the UK, so I don't know. Maybe they had more ethics. I was this and that. They were just gentle with me. It was almost like I went for therapy. You feel me? So I left there feeling life can be beautiful. Then I came here. I met this guy, and he was just
The guy didn't even have your time,
just
right?
took took my tooth, like everything, and then he was like, "Get the fuck out of here." That was the attitude he gave me. I was like, should I had to ask questions.
Like, what do I do after this? Like,
Yeah.
shit.
What do you think about that? Like, do you think that's how it should be?
That is not how it should be at all.
Look at Zara now. Do you think she'll do that type of
Speaking,
thing?
I'm not even trying to make this person look bad.
No,
or
I
anything,
know. No, the
but
thing
this was
about this is,
genuinely
I
how
wouldn't even lie to the masses and say that, oh, okay, it's because of this or he had a bad day. Regardless, we're in hospitality business and we shouldn't, treat anyone like that.
Should be very hospitable.
Yeah, yes, we understand Nige is hard and Nige gets shit,
Exactly.
makes seemingly mundane things rather difficult, and then unfortunately you're going to have to transfer your aggression to someone else. But you just don't do that. You just don't do that with people.
I was just feeling like this guy. I felt like, was I annoying? Was I asking too many questions? But like, I'm not, like, I'm the patient. I'm always right.
Yeah.
Technically.
Right.
Yes, exactly.
So-
And he did swear to.
No, he didn't.
No. For him to become a doctor, he swore.
Oh, okay.
Oh, yeah.
Swore an oath to take care of you.
What does it take to be a dentist? Tell us.
You're going to spend the same amount of years as a medical doctor. So,
Are you serious?
Yeah.
That's
it's the same
super
thing.
crazy.
Where did the interest to study dentistry come from for you?
My dad. So my dad, he took my brother to the dentist one day and came back with some ridiculous ass bill. And my dad came and sat me down. I was like, you know what? I know you want to do something in the medical field, and this is all cool and fun, but hey, look at this. It's not quite medical. It's medical enough, but you get to choose your own work hours, and the pay is quite good.
Okay.
I was like, you had me at pay is quite good, and I can pick my own work hours. It's like, okay, up to it. So I went there. I wasn't actually supposed to. So the whole story of how I was even supposed to go to school wasn't even how I went to school. I finished school early, like 15, 16, high school 15, 16. My dad was like, no, you're not going to uni unless you're at least 17. So I was looking for what to do for the time being. Went to A-levels, at least, it's supposed to be 2 years, did 1 year, then came back to Nigeria for summer break, and my school came in for interviews. They had done it once, that was that was the only time they'd ever done it. So I got an admission on the spot, but they had told me I only have 1 day to think about the offer.
What kind of pressure is that? Those people are just like,
bro.
that's so much pressure. Somebody's about to like get into like their life, and you're giving them 1 day to think about it. And these people are kids, like they're not even fully grown.
Dude, I was literally
That's
16. 16, 17, and I was like, well, this is heavy. I haven't even finished A-levels yet. So like, what am I gonna do? Okay, whatever. I'm just going into school. And I remember that my dad actually wanted me to go to school in Cuba.
Wow,
That's amazing.
Cuba? Why Cuba? Like, who thinks about Cuba? Your dad is cool.
Cuba. There's a movie I
think
like,
he's
Cuba.
I think he's low-key.
It's like an island, right? Is that where Rihanna is from?
South America.
No, that's
Barbados. Fidel Castro, Cuba. Where the Cuban cigars come from.
Yeah. So it's outskirts of the Americas. It's not under America, but I think it used to be, and Fidel fought for it or something like that in that.
I heard there are some Yoruba people in Cuba.
Yeah,
Oh, for sure.
there's a lot of Yoruba people in South
Spanish.
America.
Yeah, South America.
Brazil.
Brazil has the second highest population of Yoruba people.
As in, you enter there, just be
That's mad. Like, what's in the happen?
Otilo.
Kilele.
So that's how my little journey into dentistry started.
So where did you end up studying it?
In the UAE. So I took up that 1 day offer and just up and left A-levels, went to study in the UAE, and then...
How did you find it? Like,
I mean, school was school, really. It's like, you put your head down, go to classes. When you can enjoy your life, you enjoy your life. And just
how long did your course take?
5 years, and then the last year is supposed to be for internship, but they give you the option to do your internship. They'll graduate you before that internship year, so you get the option of going to do your internship wherever you want to.
Did you do somewhere?
Came back nice.
You did your internship here, right?
Yeah,
Okay,
nice.
yeah.
So I did it in National Hospital.
Mad.
Yeah.
So I was like, when I was asking how did you find it, I'm speaking like in school, like, I mean, you didn't have any idea of doing dentistry. You were talked into it in a way, and then starting to go into it. Like, did you develop your own interest for it? And like, was there anything that was like, I don't know, unorthodox to you? Because I can only imagine like what the classes would be like, and there will be modes of dentition. And all this kind of stuff. Like, was there any moment that was like, wow, I'm actually doing this? Like, this is different.
So, shout out to my parents for A1 parenting or whatever. So, I would say that even when they had just like, my dad ushered me slowly, or they had ushered me slowly into, okay, take this course. I was, before even entering uni, that summer holiday that I actually went for the interviews, they made me intern at a dental clinic, which I ended up working for even after graduation. So every time I was back home for a holiday, I would intern there.
You were already like getting in.
So I was already getting into the groove of things.
Yeah.
Even before I started working on patients while I was in school, I already started here in Nigeria, but like under supervision, little things.
Okay.
So it was at that moment I was like, okay, I'm really doing this thing. Like, obviously when you're in school, they teach, the first 2 years they teach you very generic, medical stuff, and then they start to branch out slowly. And when they start to branch out slowly, you start to see that, okay, you're actually specializing in a particular subfield or whatever.
Okay.
Yeah, so did that. Then from about third year, when it's like you're fully into dentistry now, you're learning the basics of it. At that time, I was already seeing patients, so I was a year ahead of my
peers.
Ahead of my classmates and seeing patients already.
Okay, yeah.
But just like for very minor things, started that out. And then I was like, okay, this seems relatively easier, and it seems like as if there would be less complications as opposed to like when it's full body. Although it's very technique sensitive, because it's very delicate, and its area is so small. It's just a matter of changing perspective and just adjusting to what you're supposed to be working on. And I was like, okay, well, this seems doable. And the fact that as soon as it's like 5 o'clock, I've removed my lab coats. Nobody's calling me for anything.
Yeah.
It's very hard for people to call you for anything that really has to take you back into the clinic or hospital. For anything dental. There's nothing that you can't just tell them, okay, go and get so prescription. I'll see you in the morning. Do you get me? Except if it's there. There's nothing really so much, except if it's something
What's like the craziest thing that can happen to somebody's teeth?
Craziest? That's a very well-devised question.
Root canal.
No, a root canal is not that's not even. I've had a root canal. So the same way, whenever patients come in, they're like, oh, but it's going to be painful and this and that. And I'm like, no, it's not. Or yes, it is. Or I'll tell them what it is. People are like, how do you know? You're the one operating. And I'm like, I'm pretty much being the patient too, as well as the dentist. So I technically understand what everybody is going through. Yeah. Like, I know how to actually talk you through, this is what to expect. Yeah. This, at so point, this is what you're going to expect. This is what I did. Yeah. This is, you get.
I've seen a video of you actually doing it to yourself, like pulling out your teeth and
wait, what? Your teeth. You pulled out your own teeth?
You installed a veneer. Is it veneer?
Yeah, it was a crown. So it was a crown. So I took out a crown. I have a crown on a tooth in the front. Yeah. And then I put a video on Instagram of me trying to put the one that is the perfect shade, because I had two of them made. One, the shade was slightly off. So that's the one I took off. Yeah. And then I fixed it back again, like the correct one. And I just took a video of it. And I was like, dentistry is like one of those like occupations that if you're confident enough in your hands, you just trust yourself to do something, then that's what it is. It's a very practical job. All the things you learn in theory are just for you to go and tell them, hey, I've done the theory part. Yeah. I know what you're talking about. I have the basic knowledge of what it is. Right. But the basic knowledge is just enough for you to build up on. Because by the time you take that basic knowledge to practice, that's where you start to be good as you can get.
You can get, yeah.
Yeah.
I feel you.
So,
I once removed my own teeth. When
By
I was,
yourself?
Yeah, when I was a child with
Bicycle.
thread,
Oh.
okay, so that's a baby tooth.
But it was shake. It was like your milk teeth.
of course.
Yeah.
It's a baby tooth. Yeah, there's so many
Snapped it out.
so many ways to get baby teeth out,
yeah.
and I feel like they're all creative. It just depends on the child.
Yeah.
Which, by the way, that's actually what I want to do in dentistry. I want to be like a pediatric dentist
For children, what's that for children?
kids. Yeah, for kids. It's always been my
I think that time everything is still forming, so you can like align it properly.
So you
and
now
everything.
see if you're able to get them when they're young, they're not gonna have that
they don't
horrible
have problems.
experience.
Yeah.
And then it just rolls into adulthood where it's like they've been comfortable since childhood to get to see their dentist.
Yeah.
It's by the time you get into adulthood, it's just like, okay, that makes it easier for me. Honestly, I do the work that I'm doing because I want to make my life easy. I'm not even gonna lie. It's like it's like I tell people do this and do that and do this. Like it changes so much because by the time you now come and meet me, I have so much less to do. It sounds very lazy, but it's also helping.
I feel you.
But like as
I
a
get
dentist,
you.
can you be like a personal dentist?
Yeah.
Like you said, your closing hours is by 5 p.m. and then it's like everything is on appointment based and stuff. Yeah. So like yeah. So being a private dentist, what is that plan like? Or like do you know about?
Okay, so I'm already
yeah.
a private dentist.
Okay.
I work in a private clinic. When I was in National Hospital, I was working. Obviously, that's a government hospital,
Yeah.
so I was a public.
Okay, maybe I'm going for
officer.
personal dentist rather
Personal.
than private. Like, for example, closing hours are done, and a client can a client call you and be like, yeah, pull up.
So
7
basically,
PM,
like
I
a
need
VIP type.
Yeah,
I'm
I
at
need
the
to-
price go choke because bro, I've gotten my teeth like I've gone to the dentist and that shit is expensive. I don't know.
Yeah,
it's so
because
expensive.
You need the whole things, all the things.
Exactly.
So you have to. Appointment works best.
Yes.
Appointments is always better, but you do have mobile dentists. I think that's what you're trying to
Yeah.
say. Yeah, you have a lot of mobile dentists. It's actually quite popping right now
Yeah.
in the UK. A lot of mobile dentists. At least that way you don't get to really pay for rent. What you're really paying for is more like
The bus.
petrol, like
Service.
gas, like gas. Sorry. But yeah, factor if you're able to move around with that chair, because the chair is like basically the most important thing.
Okay, yeah, the chair has the
Really?
lights,
The chair?
Yeah.
The one that
sink.
has
Pretty much.
everything.
Yeah, pretty much.
the
It's
drill.
pretty much that. Like if you have electricity and shade and that chair, you've set up a dental clinic.
Wow.
You've pretty much set up a dental clinic.
That's crazy.
It's the chair takes up a
Most of
factor.
it.
Yeah.
It's like Gadget Boy.
Yeah.
has everything
Or
attached
like
to it.
Batman's utility belt, you know, it's that
utility
thing.
belt.
It's that thing that is just
I heard
it just
you.
makes it
The
dental.
last time I got my teeth worked on was it was in my friend's house. It was a mobile like
Oh man.
Yeah.
the guy.
What did you
I just had to. He just washed my teeth.
Oh, okay.
Yeah, and like he had to just go get some chemicals and shit, and it was in the house. I was
Yeah.
like, yeah, this is cool. Like I prefer that.
Yeah, it's very easy to get like a mobile dental hygienist. Those are easier. So cleaning is quite literally the easiest thing you can ever do. A dentist can ever do, and that's what I started with.
Okay.
Just learning how to do cleaning. So the thing about it is less the work. It's teaching whomever how to guide their way around the patient's mouth. How to be
Yeah.
gentle. How to maneuver other instruments. You're holding with one hand, doing the other thing with another hand. There's an instrument taking out water with the other hand.
Yes.
You know, so it's a lot of learning how to multitask and be ambidextrous and things like that.
Right.
That's
So-
interesting. Would you say it has made your hands steadier?
For sure. For
I can
sure,
imagine
for
because
sure.
you're dealing with a small space and you're like,
Yeah.
Yeah, for sure, for
Precision.
sure. Yeah,
Yeah.
precision and sensitivity or tactile sensation.
Yeah.
Like just being able to be very light. Yeah,
okay.
just be very light.
Faint on it,
Yeah.
Interesting.
Enough to do the work, but not heavy enough to be painful.
Okay.
It is what it is really that. So it's just, but I think again with that is a whole lot of years of practice.
Practice.
It's a whole-
What do you
like,
think
just like
about
everything.
people getting veneers?
Thank you. I really want to talk about veneers. Like,
Because like I saw a video of my like one of my some of my relatives have veneers on, and like
Like
their
complete
teeth,
their whole teeth.
everything, bruh. And
So-
like they had to file that whole P, and like their real teeth
Yeah.
is not like a nice
Are they
sight.
sustainable? Are they something that,
So
that would
what?
last time?
So what your relatives did, it wasn't veneers.
What was that called?
Those are called crowns.
Oh.
If they have to file your teeth
then,
so
yes.
to such a small bit, then those are crowns.
Yes, I think
Yeah.
that's what they got. No veneers.
Yeah.
What's the difference? What are veneers and?
So veneers only, some of them you don't have to file teeth at all.
Just put them.
Just snap them on, cement them on. Some
So
of
you
them,
can take them out anytime.
I mean, you can, but it's not a situation where you could just remove it. So it's
Yeah.
not as easy as like removing grills or something.
Yeah.
That's cemented really, like it's meant to hold on
Mm-hmm.
for a reason. But the other way for veneers is just it doesn't take up as much prep. Like I don't have to file down your teeth a lot, just a little bit off the top, just enough to
For it
make
to
it like
fit the
just to
thing,
fit,
yeah.
and so it doesn't look bulky.
Yeah.
You know how you have
I've
the-
seen some crazy veneers.
like the
man. Some
Brazilians. Brazilians, I don't know why their teeth there.
when they smile.
When they smell, it's like you have to know that they have veneers on.
Yeah.
I'm like, oh, okay.
Yeah.
Sorry, you spent a lot of money, I guess.
Yeah, people spend hella money on their
I've
teeth.
seen it.
So
have you
now-
seen The Weeknd? Like
Have you seen Lil Yachty? He spent 100K on his teeth.
on his veneers? Like some of them,
100K.
So now-
you can detect it, some you can't.
So now, the thing about it is, if you're an entertainer, by all means,
White
by all
teeth.
means,
Mhm.
veneers, get them done. If you know that your whole
You smile a lot. You
not
have to
just
smile for the
smiling,
cameras.
smiling and presentation is
yeah.
there. You have the money for it. Invest in a good smile. No, like
Goes into your looks.
it goes into your looks. Everybody will be addressing you. In fact, you just be talking and people are already smiling
Yeah,
because
I
I
they
watched
see-
Yeah,
I
like
watched
Soulja
an
Boy.
I watched an interview yesterday of Techno, and I was like, yo, bro, this nigga's teeth looking white as fuck. And then he now actually said it on the interview that he got his teeth done.
Yeah, it's
Like,
such a. It's
yeah,
such a great
I did not really know about veneers before. Like it's of recent, let's say the past 2 years that I found out about them.
Yeah, they got popping real quick, real soon. It's a great investment if you know that it's especially going to help you with self-confidence
Right.
and just your work. That's
Yeah.
great. I'm like being very ethical about it because my job is still very heavily based on ethics. I would say for a lot of people, if you're young and you don't need to, stay away from it.
Yeah, because like I don't buy into it. And my teeth is
Yeah.
not the whitest. My teeth is not even white. It's yellow. I have yellow
Everybody's
teeth.
seen.
Everybody's
That's
seen.
the,
Yeah, I know. But
that's
like,
that's the one thing I want to say. Let me address it now.
I get my teeth washed though. Like I have.
Let me address this now. Okay? Unless you have already artificially done something about the color of your teeth, everybody's teeth, and except you're a child, hence why their teeth are called milk teeth,
Very white.
your teeth are not supposed to be white.
It's supposed to be yellow.
They're actually off-white.
Yeah.
So anything off-white, that's the actual color of your teeth. So if you think your teeth are brown,
Don't be feel depressed. Don't
Exactly.
feel
don't be
downcasted.
too
Lift up
depressed.
yourself.
Just at least find out from a dentist if indeed no, this is bad and I need to do something about it. How?
Your teeth should be like.
But
upright.
yes, by all means. And also another thing that people don't realize is that if you're darker skinned, your teeth against your skin tone will look brighter.
Oh,
If
yeah.
you're lighter skin, your skin against
Yeah,
your
exactly.
teeth.
That's why Michael Blackson has a very bright smile.
Hey, he could.
Type
He's
stuff.
also an entertainer. He could have also
Definitely
artificially.
got that he lives in
Yeah.
Hollywood, bro. He definitely everybody in
Yeah.
Hollywood is like a thing. It's a
I was
movement.
I was
Yeah.
sneak
The
this
teeth
but
are-
it's calm. It's giving like Zen vibes, talking about teeth and like
Teeth,
you know,
right? I swear, it's
you know,
like some,
dental health.
pull up to Rick Rubin's house to talk about music, and you guys
Yeah.
are talking about some
some
shit.
I don't think I had this long a conversation about you.
teeth.
Nobody does. But
Yeah.
please.
So hygiene, like what is the best way to keep your hygiene up, like so you don't have to go for cleaning or like to maintain after it's been cleaned, to avoid plaques and them ones.
So honestly speaking, you cannot totally avoid it. It's going to happen. Your mouth is wet. Bacteria likes tight and wet.
Hot places.
Yeah, no, it's correct.
You need to try and talk.
Phrase it.
People should try and talk because when you don't talk, my last the
Phrase it.
dentist that work on my teeth told me like, bro, like the longer you stay without talking, like if you keep quiet,
Yeah.
like the heat
Yeah.
would make like
The bacteria.
the
Yep.
bacteria.
It's like cooking. It's
so,
there.
like, the action
They'll
will be
start
faster.
fasting. They'll start.
Yeah.
You feel me?
They're literally having a party in your mouth.
Oh,
It's
God.
Like, no doubt.
Bro, since that guy explained that thing, I've not
Yeah.
gone without brushing morning and night. Do you understand?
It's
Sometimes in the
literally-
afternoon, spontaneously, I just give them. Do you understand?
But yeah, it's literally
Yeah.
that they're literally having a party in your mouth. So there's really little you can do. You can't stop the saliva in your mouth, and you're not supposed to anyways. You can't stop the saliva from producing in your mouth. You don't even want it reduced at all. In fact, if it's possible for you to have more saliva, it's gonna be better for you.
Yeah,
But
all
it's
those
just,
things.
Oh, I know
it's
that's
just,
right.
it's just very.
Excuse me.
Okay, what's wrong?
I'm just saying like.
Okay.
But just obviously, it just doesn't look good. You're not a baby that's
Yeah, I feel
drooling
you.
all over themselves. But yeah. So to prevent plaque, there's not really much you can do, but you do have regular things that I always tell people to do that will help you in the long run, not to reduce times you get your cleaning done, but just in the long run. First things first, brush twice a day. It sounds so trivial,
Cliche.
and it's like very cliche, but it does.
It works.
It works. It just works. It's like if it ain't broke, don't fix it.
Yeah.
It's just standard. 2, which is one that I'm glad that more people are doing, because I've even had people tell me that from 3 years ago when I told them this bit of advice, it changed their lives. When you brush, don't rinse out the toothpaste.
Really?
Ooh, that's controversial to me because I've seen don't rinse out the toothpaste.
I don't understand.
And I've seen
just like when you
should
finish,
rinse out
just
the
go
toothpaste.
continue your day. Like when you brush, just don't
to
pull
close
water.
your
Just
pineal
go.
gland.
So you
Yes,
spit
That's
out.
controversial.
If it has fluoride inside.
Yes,
No, but
fluoride.
every toothpaste should have fluoride in it. So I'll explain that in a very scientific way. This thing about fluoride.
I mean,
'Cause a lot of
conspiracy theory, so I might fight
yeah,
it.
a lot of people
Yeah.
are like scared about fluoride, and we get it. Fluoride is
It
bad. Like,
decalcifies
it
your
does. Yeah, it
pineal
brittles
gland.
your bones and stuff like that. Like it gets really intense. However, that is when the fluoride has passed a certain
percentage.
sort of percentage inside toothpaste, and there's no toothpaste. There is no toothpaste.
Euthymol. I use Euthymol. It doesn't have fluoride
That
inside.
pink stuff.
So hold on. What I was going to say is there's no toothpaste that is above 0.01 parts per million fluoride
Really?
inside.
Is that little?
It's that little.
Mad.
It is actually that little. That is enough you need to protect your teeth. So unless you are literally eating tubes of toothpaste, it's not gonna have an effect. If you're not eating tubes of toothpaste, that is okay. It's enough. You just need a coating on your teeth
Yeah.
to keep it healthy, like to protect it. Fluoride is to your teeth as sunscreen is to your skin.
I don't use sunscreen. Is that bad?
Why?
Like we shouldn't use sunscreen as
We are
like
black.
melaninated
As in
people.
we are melaninated.
Right?
Wrong.
Yes.
I heard like it's like I mean okay we have more tolerance of like radiation.
Our
because
skin is
of-
tougher.
Yes, because you have melanin in your skin, your chances of getting sun damage are less. Does not mean sun damage does not happen. You
True.
can still get skin cancer, even as a black person.
Fair.
Does the sun give skin cancer?
Yeah.
Yes.
Really?
Yes.
And the kind of sun that is out here in Abuja this season.
It is
bro,
not cute. It is not
it is
cute.
Yeah, it's been very
Wilding.
hot, but I didn't know the
It's
sun
not
gives skin
wilding.
cancer. This is
The
the first
sun
time
right
I'm hearing
now.
about this from a dentist.
Okay.
Wow, okay. Shout
So,
out.
so let's not drift off to this.
Okay,
skin.
yeah, so that's number
dermatologist
2.
and
Number
dentist.
2, health advice. Don't rinse
Don't
out.
rinse.
Don't rinse out. Just spit. Spit as
spit.
much as you
Wow.
can. Yeah, just spit.
That's going to take a lot of getting used to for me.
Trust me.
That is very true, but it only takes 3 weeks for a habit to form. 21 days,
Yeah.
and you've
For a
created
fact.
a new habit.
For a fact.
So if you just do that routinely, if you like, you might forget in the morning, but try not to forget at night. That sort of thing. Okay, try as much as possible, just reduce it, and then you
So what's
see.
the effect of you leaving it on your teeth.
So like I
versus-
said, I said, it's like sunscreen. So if you've put this fluoride protective layer over your teeth, fluoride helps to tell your teeth, okay, produce more dentin or enamel to protect it from making holes. So that's why you see a lot of toothpaste anti-cavity.
Right.
They have anti-cavity protection, cavity protection, things like that. The fluoride in it, it's like a medicine that tells your teeth, oh hey, jazz up, we need to repair.
Yeah.
There's a place there that looks like it's about to be weak and a hole is about to form. Let's go and
block it.
repair there. It's almost like antibiotics helping your white blood cells to repair themselves, things like that. So
I get you.
Yeah.
There's like, if you use charcoal on your teeth, is that good?
I mean, good is relative, but
I heard it's good for your teeth, charcoal.
people use it because it has a whitening effect. So it has the effect to make your teeth look lighter.
Really?
Yeah.
Because I just feel like it looks lighter because you just rub charcoal all over it.
It's just like some placebo effect in your head.
Yeah, just like you, I just washed this charcoal. Look how bright my teeth are.
Exactly.
I mean,
Right. It can be like mental.
yeah. Some people it's mental. Some people, I mean,
It's probably one capitalist that just sat down and yeah,
I mean,
this business is about to be booming.
to each
It's
their
like
own.
slimming tea.
Yeah.
I don't trust all those slimming tea.
So like,
Slimming tea is just a bunch of laxatives
whining.
inside.
Drink this
since we have a
tea,
dentist here, like we can consult you on certain things. Yeah. So, so don't worry. We'll put it. We'll sponsor this for free. So I had like a root canal on both sides from when I was licking Milkos from when I was young. Shout out Milkos. And then the mess this one up. That was why I had to get this one pulled out. But this one I haven't like dealt with it yet. But I've been chewing with this side of my mouth for like the longest, and I've not been chewing with this side as much. Does that have a long-term effect on your? What kind of effect is that?
Question: why aren't you chewing on that side? Is there pain?
Because I just don't want to get food inside the hole.
There is a hole.
Yeah, there's a hole.
So
But we've done the X-ray, so it hasn't gone all the way bad yet. I can still refill this one apparently.
okay.
So I've been procrastinating it. I can still refill this one, but yeah, I just don't allow food to get there because.
Okay. So even if you don't allow food to get in there, the bacteria in your mouth will
Would go
still,
there. Find their way.
it will push the bacteria that's not supposed to stay in your mouth towards there. So even if you're eating there, food still travels no matter what you're doing. You're talking right now, particles will move with your saliva to that part.
Right.
So it's not really the most convenient way to prevent a hole from getting bigger. It's not.
Yeah.
So if you've done the root canal already, what you do need to do is to just get a crown on that tooth, and that's protecting it enough.
Okay, so
But if you've not done a root canal, then try as much as possible to just get that hole filled up, so that you don't have to get a root canal.
the root canal is refilling your teeth or removing it. What is
It is-
the terminology for?
You're putting a filling, but the filling is not just surface level.
Okay.
You're going into the root of the teeth.
Yeah.
So inside your tooth, you have nerves and blood vessels.
Yeah.
So a root canal removes the blood vessels and the nerves from the tooth.
Yeah.
So it basically kills it. You're like hollowing out a tree.
Yeah.
You just
So
have
you gotta
just
go deep.
Yeah, just go in. So once you've hollowed it out, you now fill it up with artificial
stuff. Yeah.
material, and that's the root canal.
I'll send you a video I have. I was watching it. I
Sick.
find things like that interesting.
Weirdo.
I'll send you a video.
Weirdo.
Oh man, that shit is crazy.
So like we have to wrap up, but there's this very important part we can't leave out. So one of Jaden Smith's rap, he was like, "My jeweler, a dentist." Do you feel like people who have to be like who do grills and stuff? Do you feel like they should be dentists, or like are they dentists, or do you do jewelry like mouth jewelry?
Yeah, it's definitely safer to get it done with your dentist, because obviously they know,
How to treat the teeth.
yeah, they will know just the right amount to,
Yeah.
obviously do enough to not cause harm to your actual teeth. A jeweler is not a dentist,
Yeah.
but a dentist can be a jeweler.
Yeah. So are you finding that interesting?
I think at first when I was probably younger into dentistry, I was like, nah, these people shouldn't be doing these things.
Yeah.
And then I just realized, wait a minute, it's actually pretty easy. As long as they already have, technically, they're the jewelers, but not really. So they're the jewelers themselves, and really it's not hard to take a recording of a patient's mouth. That's all you really have to do. Just do that. Once you do that, they know how to build everything up from there. And that is the main work. And
Getting something that fits into your mouth perfectly.
Yeah, exactly. So that is the main work. The main work is...
Sorry.
Girl,
I'm sorry. No, I don't know why there's a lot of phrasing in this episode.
It's
so crazy.
There's a lot of oral.
It's just a lot of oral. Shout out Rita. So, yo, thank you guys for listening and sticking with us on this episode. It's dentist stuff. Get enlightened. Get your mouth health up.
Oh, one more thing.
Go on, please.
Please stop using toothpicks. They are not good for you.
Are you serious?
I promise you.
Babsy.
Stop
That's
using
my cousin.
toothpicks.
He always has a toothpick in his mouth. Babsy.
Stop
floss.
Hope you're hearing
using
this.
floss is your best friend. I cannot tell you how many people have removed their teeth because they said the only thing I don't use toothpick for is water. Time to remove your teeth. So please stop using toothpicks. Toothpicks are supposed to pick up small chops from the plate, and that is all.
Toothpick. But why do they call it toothpick?
It's supposed to be like a pick to remove food from in between your teeth. But then the toothpick is wider than the space.
Well, let me tell you one more weird thing about
it's like
myself.
you're forcing
When I was
it.
young, I used to deliberately hurt my teeth. I used to enjoy the pain.
Okay,
Sorry
masochist.
guys, I'll actually
Why?
I don't know. It was just I didn't understand it. So I had to stop.
Yeah.
I would actually poke my teeth and the pain was just like. But
Thanks
guys,
for liking.
I'm not that guy anymore.
Subscribing, following the Big Talk podcast. Thank you so much, Zara,
And if
for
you need,
joining
Thank
us.
you for having me.
If you need to book your appointments, you can come through me. I'll give you a 0.0000.
Do you want to plug anything on flag football real quick?
Of course I do.
Yeah,
I always
do
want
that
to
real
plug
quick.
it, so I'm going to
Shout out
plug in
Lagos flag
everything.
football.
This is don't make me beat you up right now.
Shout out Lagos
So
flag
I'm going to do a shameless plug of everything that I need to plug in right now. First of all, hit me up. Message me on Instagram, but Blanche Dental Clinic, because obviously it's a dentistry episode. So Blanche Dental Clinic on Instagram. They have Lagos and Abuja branches. We've got you covered. That's
I'm
one.
gonna give you a raise.
Yeah. It's in the works. I'm doing the Lord's work. I'm fighting for my bag. I'm working for my 2K.
Free promo.
Second thing, Abuja Flag Football on Instagram. I'm a very sporty person, so if you're interested in sports, interested in finding a community that's for you, that's very accepting, very accommodating, but you just want to do something out of your comfort zone, build a little bit of confidence, get a summer body that's going to be present for all of the year. Abuja Flag Football. Third thing, I play footy, actual soccer, if you want to call it soccer, but it's not soccer, it's footy, football. We have International Women's Day tournament on the 8th of March. It's going to be a 5-a-side competition, mixed girls and guys on a team, and it's going to be like name a 5-a-side. We're going to play for a trophy or a cup, and yeah, that's
it. Right. Lit. So yeah, you heard it here. Everything she just mentioned will be in the description of the video. So please check the description of this video. Thanks so much for rocking with us. If you're not subscribed, please do that right now. It's Big Talk, the biggest podcast. Peace. We's out.
Salem.